Hello, good day everyone. I am Karen Aloza Magalona, a BPED 2 student. Right now, I will be reporting about my topic in PED 5 entitled Learners with Difficulty in Remembering and Focusing. What is learning disability? Learning disability is a childhood disorder characterized by difficulty with certain skills such as reading or writing in individuals with normal intelligence. Learning disabilities affects the ability to interpret what one sees and hears or the ability to link information from different parts of the brain. According to Individual Disability Education Act or IDEA, the official term that are used often for children who have difficulty remaining focused on a task that they are capable of doing are attention deficit disorder or ADD and attention deficit hyperactivity disorder or ADHD. There are at least two types of memory problems, working memory and long-term memory, which can lead to difficulties in learning. Problems in working memory can lead to difficulties in learning because the individual may have less space in working memory for organizing and integrating new skills or knowledge of a child. From National Joint Committee on Learning Disabilities also, or NJCLD, learning disabilities is a general term that refers to a heterogeneous group of disorder manifested by significant difficulties in the acquisition and the use of listening, speaking, reading, writing, reasoning, or mathematical abilities. These disorders are intrinsic to the individual, presumed to be due to central nervous system dysfunction, and may occur across the lifespan. From a report also of special education, students with learning and attention issues are 3 times more likely to drop out in school. 1 in 5 children have learning and attention issues or brain-based challenges in reading, writing, math, organization, focus, listening and comprehension, social skills, motor skills, or a combination of these according to the National Center of Learning Disability or NCLD. In a new report, the NCLD examines why students facing these issues are 3 times more than likely to drop out in school. For the state of learning disabilities, the NCLD used recently released data for 2015 to 2016 school year and other field leading research to shine a light on the current challenges and opportunities facing the 1 in 5 children who have learning and attention issues such as dyslexia and ADHD. The report introduction states, offering up statistics, the first-person stories, recommendation, and more in the report. NCLD looks at how specific learning disabilities, or SLD, can impact a student's success, starting in K-12 and moving on to college and the workplace. And last thing, according to American Psychiatric Association, or APA, another type of disability is learning disability, a term used to describe a range of academic difficulties. Dyslexia, a reading disability, is one of its examples. Psychologists and psychiatrists can help individuals with all the kinds of disabilities, while some interventions focus on teaching stress management and other coping skills. Others focus on disability itself. There are characteristics and types of learning disabilities to mention with. The first one, dyslexia. It is a difficulty of reading. There is a problem reading, writing, spelling, and speaking. Second one, dyscalculia, difficulty with math. Problems with doing math problems, understanding time, and using money. Third one, dysgraphia, or difficulty with writing. Problems with handwriting, spelling, organizing ideas. The fourth one, dyspraxia or sensory integration disorder, or difficulty with fine motor skills, a problem with hand-eye coordination, balance, and manual dexterity. Fourth one, dysphasia or aphasia, difficulty with language, problem understanding spoken language, poor reading comprehension. Fifth one, auditory processing disorder or difficulty hearing differences between sounds, problems with reading, comprehension, and language. Last one, visual processing disorder, a difficulty interpreting visual information, problems with reading, math, maps, charts, symbols, or pictures. Next one is the attention and behavior disorder. They are highly distractible, lots of movements, disorganized, short attention span, difficulty following directions, has difficulty responding quickly. Comments might seem off topic, troubled with open-ended tasks. Another area also of learning disabilities is in socialization. There are difficulties reading nonverbal cues like body language and facial expressions. May not also utilize appropriate verbal and nonverbal cues in interaction. Difficulty understanding like jokes, puns, sarcasm, or idioms. Difficulties with rules of conversation such as turn-taking or any task delegation. Difficulty with physical space. And the last one, may not follow instruction appropriately and get into trouble but not understand the reason why. The last area of learning disability is what we call the other side. Difficulty determining the main idea. This part affects the reading and note-taking. Another one, difficulty in summarizing or remembering. Difficulty adjusting to new settings and routines. May pay too little attention or too much attention to details. Task avoidance. Performance is affected by emotion, health, and environment, and could not have word-finding problems when speaking. The last one, sensitivity to loud noises, touch, and light. There are causes of learning disabilities. Based on a resort and research, there are no proven causes of learning disabilities, yet there are related causes in it. The first one, heredity. This may often just run in the family, or what they call it runs in the blood. Second one, problems during pregnancy and birth, such as the mothers involved in drugs or alcohol abuse during pregnancy. There is a low birth rate, lack of oxygen that results to a premature or a prolonged labor of the child during birth. Third one, incidents after birth. This talks about serious illness, head injury, poor nutrition during pregnancy stage, exposure to toxins such as lead can contribute also to any form of learning disabilities. Identification and assessment of learners with learning disability. There are 4 to 6 ways. First one, presentation. A presentation is a verbal demonstration of skill, knowledge, and understanding. The child describes, shows, and offers to answer questions about her or his task. Presentation can also take the form of discussion, debate, or purely question and answer responses. Some children will need to speak in a small group or in one setting, as learning disability students are often intimidated in this setting. However, with ongoing opportunities, they will begin to shine. Second one, conference. A conference is one-to-one between the teacher and the student. The teacher will prompt and cue the student to determine the level of understanding and knowledge. Again, this takes the pressure away from written tasks, and the conference should be somewhat informal to put the student at ease. The focus should be on the student sharing her or his ideas, reasoning, or explaining a concept. This is an extremely useful form of formative assessment. Third one, interview. An interview helps a teacher to clarify the levels of understanding for a specific purpose, activity, or learning concept. A teacher would generally have questions in mind to ask the student to respond to. Very insightful method, but this can be time consuming. Fourth one, observation. Observing a student in a learning environment is a very powerful method to assess. It can also be the vehicle for the teacher to change or enhance the specific teaching strategy. Observation can be done in a small group setting while the child is engaged in learning tasks. Things to look for include, does the child persist? Or does the child give up easily? Or have a plane in one place? Look for assistance or try alternate strategies. Does the child become impatient or look for patterns? Teachers need to be prepared for what they are specifically looking for in observational setting. Fifth one, performance task. A performance task is a learning task that the child will do while the teacher assesses his or her performance. For instance, you might want to check some math problems by solving and asking if 6 people fit in one car. How many cars be needed to transport 42 people? During the task, the teacher could be looking for attitude, skill, ability, and evidence of risk-taking. The last one, which is the self-assessment. We always want our student or children to be able to identify their own strengths and weaknesses. Self-assessment will lead the students to a better sense of understanding of his and her own learning. The student may need some guiding question such as, what do I do well on? How can I improve upon? Where was my biggest strength and my weakness? And these are the plethora of assessment strategies. I've merely focused on the ones that supports the learning disabled students.